Have you ever wondered what happens when your tooth starts reacting to hot, cold, or sweet stimuli? It could be a condition called pulpite reversible, but what is it? Pulpite reversible is a minor initial inflammatory change in the dental pulp, the soft tissue in the center of a tooth. When a tooth is exposed to certain triggers, it can cause a mild inflammation in the pulp, kicking off this condition, but the body is a wonderful healer. Tissue repair can occur, reversing the inflammation as long as the triggering agent is removed. However, if these irritants persist, pulpite reversible can escalate, progressing to irreversible pulpitis and even necrosis, the death of cells or tissue. This progression underlines the importance of early detection and treatment. So that's a quick introduction to pulpite reversible. Let's dive deeper into its histopathological characteristics. So what happens inside your tooth when you have pulpite reversible? Well, let's dive in and explore the histopathological characteristics of this condition. When a tooth experiences a deep carious lesion, the pulp, the innermost part of the tooth, responds with what we call pulpal hyperemia. This is basically an increase in blood flow to the area. Along with this, the pulpal blood vessels dilate or expand. But why does this happen? This is the tooth's way of bringing in more nutrients and immune cells to the injured site. At the same time, there's an increase in capillary pressure, leading to edema or swelling. This is due to the accumulation of excess fluid. Alongside these changes, there's also a mild to moderate infiltration of inflammatory cells. This is your body's immune response kicking in to fight off any potential infection. So these are the changes that occur inside your tooth when you have pulpite reversible. But how do we diagnose it? So how do dentists determine if you have pulpite reversible? Well, it's a bit of a detective job. Interestingly, pulpite reversible is generally asymptomatic, meaning you may not experience any noticeable symptoms. However, there can be sharp, fleeting pain in response to stimuli. If you've ever winced while sipping a cold drink, you might have felt the common cold sensitivity associated with this condition. During an inspection, dentists may detect extensive caries or restorations, but there's typically no exposed pulp. But hold on, don't let that fool you. Irreversible pulpitis can develop even before pulp exposure occurs. Now let's talk about some tests. Pulp tests, to be specific. When exposed to heat, you might experience either late or immediate pain, depending on the response of your A delta nerve fibers. Cold, that brings about sharp, localized pain that quickly subsides. An electric pulp test might provoke a tingling or burning sensation similar to that of a normal tooth. And if dentin stimulation through a cavity provokes pain, that's a strong indicator of pulp vitality. Periradicular tests, which involve percussion and palpation, typically yield negative results. Radiographic findings might show carious lesions or extensive restorations close to the pulp chamber. But keep in mind, it's tough to determine pulp exposure based solely on radiographs. And that's how dentists diagnose pulpite reversible, but how do we treat it? Now that we've diagnosed pulpite reversible, how do we treat it? The treatment of reversible pulpitis involves a few essential steps. It starts with the removal of the cause, which could be caries or a defective restoration. This is a vital step because if the offending agent continues to irritate the pulp, the condition may progress to irreversible pulpitis or even necrosis. Once the cause has been removed, the next step is the application of a dressing. This is typically a zinc oxide eugenol-based dressing. Zinc oxide eugenol has been a staple in dentistry for a long time due to its antiseptic and protective properties. This dressing helps to soothe the pulp and promote healing. However, the treatment doesn't end there. After the dressing has been applied, a reevaluation of the tooth is necessary. This usually happens after a period of at least 7 days. During this reevaluation, the dentist will assess the healing of the pulp and consider whether a definitive restoration is necessary. Definitive restoration could involve a simple filling or could require more complex procedures like a crown, depending on the extent of the initial damage. The goal is to restore the tooth to its normal function while ensuring the continued health of the pulp. And that's how pulpite reversible is treated. Remember, early detection and treatment can prevent the progression to irreversible pulpitis and necrosis.